Episode 1: The Silent Thief of Sight. It was a bright morning at the City Eye Clinic when Mr. Aid, a 52-year-old man, came in with a simple but worrying complaint. For months, his world had been changing, slowly, quietly, and without pain. He could see what was right in front of him, but the sides of his vision were fading, like shadows closing in. When his name was called, he walked into the doctor's office. Inside the consultation room, Dr. MJ sits across from Mr. Aid, wearing a calm, friendly smile. Dr. MJ listened carefully as Mr. Aid began to describe his symptoms.
Doctor, I've been bumping into things lately. My side vision feels like it's disappearing, but there's no pain at all.
The doctor nodded thoughtfully and said, "How long has this been happening, Mr. Aid?"
For a few months now, doctor. I thought maybe it was just old age catching up with me.
There was no redness, no irritation, just a gradual silent loss of sight. That alone was enough to raise Dr. MJ's suspicion. Dr. MJ leaned forward gently and said, "Mr. Aid, has anyone in your family had a similar problem? Maybe someone who lost their sight gradually and without pain?" Mr. Aid paused, then sighed deeply.
Yes, my father went blind years ago. It started just like this. Slow, painless. By the time he noticed, it was too late.
Dr. MJ nodded knowingly. Family history was a key piece of the puzzle. Glaucoma, he knew, often runs in families, passed down quietly, generation to generation. The doctor continued his gentle questioning. Have you ever had an injury to your eyes? Maybe an accident or something sharp hitting the eye?
No, doctor. Nothing like that.
Have you ever used any eye drops for a long time, especially those containing steroids?
I used some drops I got from a chemist for redness months ago, but I don't even remember the name.
Dr. MJ made a note. Long-term use of steroid eye drops can sometimes increase eye pressure, one of the main risks for glaucoma. He also asked about other factors: age above 40, high blood pressure, and family history. And Mr. Aid fit almost every one of them. To be sure, Dr. MJ began a series of eye examinations. He first tested Mr. Aid's visual acuity to check how clearly he could see at different distances. Then, using a special instrument, he measured the pressure inside the eyes. It was higher than normal. Next came the fundoscopy, where he examined the back of the eye, the very place where the optic nerve lives. Finally, he performed a visual field test, mapping the areas of vision that Mr. Aid had already lost. Each test confirmed what Dr. MJ feared. The signs all pointed in one direction. When the tests were complete, the doctor sat back in his chair and looked kindly at Mr. Aid. "Mr. Aid, your eye pressure is higher than it should be, and there's damage to the nerve that carries vision to your brain. You have glaucoma." Mr. Aid's face changed, confusion mixed with fear.
Glaucoma? What exactly is that, doctor?
The doctor smiled gently, understanding the weight of the question. Glaucoma, he began, is a term that describes a group of conditions that damages the optic nerve, the cable that connects your eyes to your brain. It commonly happens when pressure inside the eye slowly builds up over time. That pressure squeezes the nerve and gradually steals your vision. Starting from the sides, vision gradually worsening and reducing your vision till you became totally blind. If not detected early and appropriately managed, you may also not feel any eye pain. However, you may be bumping into objects while walking. That's why we call it the silent thief of sight. It doesn't cause pain. You don't even know it's there until part, or all of your vision is gone. Mr. Aid listened quietly, his eyes wide.
Is it common, doctor?
Yes, very common, especially among black people above 40 years. People using steroid eye medication for long. Those with family history of the disease, especially among the first-degree relatives. It's one of the leading causes of irreversible blindness in the world. But the good news is, if we find it early, we can control it and stop it from getting worse. Mr. Aid nodded slowly, absorbing every word. Mr. Aid,
How do you doctors confirm someone has glaucoma?
we measure the eye pressure using an instrument called tonometer. Normal pressure is between 10 to 21 millimeter mercury. Check the optic nerve head with an instrument called ophthalmoscope and test the visual field, a test called perimetry, just like we did today. Sometimes we use special scans to look more closely at the nerve structure. Those results tell us how advanced the disease is and help us plan treatment. Sir Ed took a deep breath, then asked a question that lingered heavy in the air.
Doctor, is there a cure for glaucoma?
And with that question, the room fell quiet. The answer would come, but not today. Glaucoma does not announce itself. It creeps in silently, stealing sight little by little until it's too late. That's why regular eye checks, especially after age 40 or with a family history, are so important. Join us in the next episode of the Health Compass with Dr. MJ as we uncover the truth about treatment, prevention, and how to protect the gift of vision.